last March, Senator Grassley and I, along with a bipartisan group of 12 additional senators, wrote to you and to the Attorney General, William Barr, to express serious concerns about the health and well-being of prison staff and inmates. At the time, the number of infected prisoners was reported to be 3, and staff another 3. That was at the earliest stages of our realization that COVID-19 was a serious threat to the public health. It didn't take a degree or Dr. Fauci's resume to realize that our prisons were particularly vulnerable because of so many people gathered in such a limited space. Well, we know what happened as a result of it. We came up with the First Step Act and other policies which established the opportunity for home confinement and compassionate release to reduce overcrowding and to allow those prisoners who we perceive not to be a threat to society to have a chance to leave that prison setting. Let me tell you the story of one of those prisoners. Forbes magazine reported a man named Jimmy Monk. Jimmy Monk was a young man, a first-time offender. He was convicted of a nonviolent bank fraud offense. His term in prison was less than a year. He collapsed in a shower and died from COVID-19 at the minimum security Talladega Federal Prison Camp. The Bureau of Prisons reported he had no COVID-19 symptoms, but his emails home and reports from those inside the prison tell a much different story. The reality was that he had multiple symptoms, received no medical attention. After he passed out in the shower, his fellow inmates rushed to help him, but the guards ordered them to leave him. Unable to even sit in a chair without the help of others, he fell, hit his head, and died on the floor. Why was a man like Jimmy Monk, a first-time offender convicted of a nonviolent bank fraud offense with less than a year to serve, not placed in home confinement? Were you given orders from above in terms of compassionate release and home confinement to restrict the number of opportunities that would be offered?
No, Chairman Dermott, I was not given any direction like that. On the contrary, I was issued 2 memorandums by the Attorney General that directed us to consider, under the CARES Act, everyone eligible for home confinement. In those memorandums was specific guidance for criteria. I assure you that if that individual you're speaking about, I won't speak about individual cases, but in general, any inmate that is eligible under the criteria presented to me by the Attorney General is on home confinement as we speak. What keeps them or prevents most cases are that they fall under one of those non-discretionary hard criteria. If you have a primary offense of violence, a sex offense, of terrorism, or a detainer, an order for deportation, you will not be placed on home confinement. As the statute is written, home confinement wasn't made for long-term placement. It's a reentry program. As you're well aware, Senator, 6 months, 10% of your sentence, 12 months in the community. At this point in time, we've released inmates under the CARES Act with more time than that, which is appropriate, but that's why the criteria is important. So we follow the criteria, Senator.
So what is the population? I mean, no one's going to argue with the groups that you have excluded from consideration for compassionate release and home confinement. What is the remaining population that doesn't fit into those categories among Bureau of Prison inmates?
An easy, let me give you an example, Senator. That when CARES Act passed, we ran a roster. CARES Act is a medical placement. We ran a roster. At that point, at that day, there was approximately 27,000 inmates eligible for home confinement under the CARES Act. When we applied that criteria, that number was reduced to 4,000 just by those 4 criteria. Okay, and the other, that so, we had discretion to go beyond that.
Excuse me, can you clarify? You said 27,000 out of the total federal prison population?
Who had at least one COVID risk factor, which is what specifically the CARES Act told us to look at, inmates who were vulnerable for COVID.
If you clarify, please. The total Federal Bureau of Prisons population at the time was over 150,000?
That is correct.
And so you identified some 27,000?
Who had at least one COVID risk factor.
And of those, you excluded many for the categories you mentioned of crimes.
We followed the criteria issued by the Attorney General at the time.
And you said there were 4,000 eligible in the Federal Bureau of Prisons?
The 4,000 was after applying the Attorney General criteria.
And
If
how
you
many
like,
were-
I can explain beyond that.
Well,
because
let me ask you, I want to stick with the numbers for a minute. How many were actually released or placed in home confinement?
we have released, we have transferred, because they're still in our custody, we have transferred over 24,000 inmates to home confinement since the passage of the CARES Act. Today, there's approximately 7,400. 4,500 of those, I'm using estimates because these numbers change every day. Approximately 4,500 of those today are on CARES Act home confinement under specific CARES Act.
It's my understanding that the prison staff, and I don't know how large a group that is completely, they have been offered vaccines and fewer than one half have accepted the invitation.
Senator, we have offered every staff member in our agency the opportunity to be vaccinated. The rate right now, the last number I got yesterday was a little bit over 51% have accepted. Now, the one caveat there is that does not include staff that we're not aware of who received the vaccine on their own through their own care provider. We do know there are people that have done that, but we have offered the vaccine, approximately 51%. That's about 18,000 staff of the 37,000 have accepted it.
And is there currently a mask mandate for all staff at BOP facilities?
Yes, there is, Senator. There has been for quite some time.
And what type of testing is offered to the staff?
Staff testing is available. Each location, keep in mind, as you're well aware, we have 122 locations. We have a national contract laboratory where we can make it available. So there's several types and methods there, but each location worked with our local public health service to establish testing sites. We do not test staff on site. We don't have the resources to do that.
Could you tell me the percent of prisoners who have been vaccinated?
The percentage this morning, we've administered over 132,000 vaccinations. The percentage this morning was a little over 40%. About 50,000 or so inmates. Again, the numbers are changing, but as I stated in my opening remarks, our projections originally were August for everybody to receive it. By mid-May, 100% of the inmates in our custody will have been offered the vaccine. And keeping in mind that it's voluntary, the acceptance rate among inmates is about 66%. Again, that changes daily sometimes.
And those who are released, is there any testing before they're released?
Inmates are quarantined, mandatory in and out, quarantined before they're released. And if we have symptoms or anything of that nature, then we will provide the test upon release. Otherwise, they're mandatory quarantine unless they're showing symptoms, which time they're placed in isolation, which is a whole separate procedure.
I'm going to take leave as chairman to ask one other question, Senator Grassley, if you don't mind. There was a lot of controversy and votes on the Senate floor about sending the checks, the stimulus checks of $1,400 to inmates in prison. This was a policy that was originated in the CARES Act that was drawn up on a bipartisan basis and signed into law by President Trump. And there have been questions raised about what happens to that money for inmates. Can you tell us what happens?
Absolutely. It goes to the inmate. We've processed right about 22,000 checks for about $19 million. We've worked with the IRS, the Department of Justice Tax Division, and the Executive Office of the United States Attorneys to ensure that those inmates who were receiving those checks, that we worked through that and they received those checks. If for some reason, like with anything, if something occurs where somebody does, all they need to do is tell us. We don't know who's entitled to the check, but we have ensured that 22,000 times inmates in our system have received those checks for a total of $19 million.
Out of 150,000 inmates?
Well, sir, I'm not sure who's entitled to them. I don't have that information.
I'm just asking you.
Yes, out of our current population of 125,000.
Isn't it true that money placed in a federal inmate account that exceeds $450 during a 6-month period, including stimulus checks, for example, is assessed by the Bureau of Prison to pay prisoner debts, including restitution to crime victims and fines?
Well, Senator, part of our policy and part of reentry is teaching responsibility. So if an inmate has child support or owes a fine or restitution, that is part of his reentry plan to be responsible and pay those debts. To my knowledge, the government, we don't assess that. We do make sure that they participate in the program to pay restitution and things like that. So there are those checks and balances, but we're not taking money from an inmate. There's a record of this. Everything is screened and gone through the policy as appropriate.
But I want to clarify this. If I'm a prisoner and I have received a $1,400 stimulus check, it's my understanding that $950 of that could be assessed to pay any restitution or fines which I have been ordered by the court to pay. Is that true?
I believe so, Senator. I'm not entirely sure about the policy. I haven't reviewed that policy lately, but I'm almost certain that if they have a financial responsibility, part of their reentry plan, part of getting them ready to return to society, 95% of them will, is to be responsible and make their payments.
And child support is the same type of responsibility?
Child support, anything where their obligations, that is part of being a responsible citizen and paying their bills.
Thank you very much, Mr. Carvajal.